Next up is, for our Entrepreneurship Award winners, Dr. Indrajit Choudhuri, founder of MEC1-based MediCardia Health. An electrophysiologist with the Freighter South Medical Group, he developed a digital health platform designed to aggregate, organize, and operationalize comprehensive clinical data for clinicians. It's now on Epic Systems' App Orchard platform. Please welcome Dr. Indrajit Choudhuri.
Good morning, everybody. Thank you for coming out. Much love and appreciation to the community at BizTimes for hosting this event. How about some interactive audience participation? Isn't that what everybody loves to do? Anybody tasted a wild strawberry, or even know what that is? No? One? Two? Couple people out there? Handful at best. Everybody's seen the size of the strawberries when you go to the grocery store, right? They're like this big now. Difference is that in these massive strawberries, the flavor and the taste is completely diluted. And you could close your eyes, you're not really sure what you're tasting. But wild strawberries that you pick, they're probably often, a number of people I heard are from Mequon or from North Shore area. You can pick them actually in your backyard. They're extremely bright. They're very flavorful. It's like nothing you've ever had. They don't actually taste quite like the traditional strawberries that you're used to, right? I see a lot of head nodding in one or two people, so I appreciate you. It makes suddenly my story is worthwhile. And that's what Wisconsin's all about. That's what Milwaukee is actually all about for the startup community. It's a tiny, small ecosystem that has a lot of intensity. There's a lot of flavor. There's a lot of energy in a very small area. And so I love the idea that we can network at a function like this, that we've got a community that embraces the entrepreneurial mindset. I am honored to be considered a member of that. I am by no means an entrepreneur. I have been lucky and successful in making friends and developing partnerships that have allowed our idea of MediCardia to create this healthcare data platform to put the power of health information back into the hands of the people, to manifest that. In brief, I know we've been asked to tell some stories. I started ideating on this back in 2017 with a good friend of mine who's a partner in the company now. We were at Rock USA, and we went on the year that was not the metal thrash year, but the rock and roll year, and it was an incredible show. But we spent a lot of time together talking about how we could use technology to change healthcare, and from that we both started working on it, and we started building the MVP in 2018, and then did market research in 2019, and found near universal validation of the concept of open access healthcare information to anybody who wants to know about themselves, because we are all going to be patients one day if we're not already, and we are the ones who are going to be creating all that data, and we give it to the larger organizations who then charge you when you want to get it back. In fact, you can, on the internet, you can search the per state maximum per record or per page charge that an organization is allowed to charge you for you to get a copy of your results. And we were joking at our table that that Verona is located in Epic, Wisconsin, and we personally are very thrilled to be in the Epic App Orchard, and much more importantly, to be able to work with large EMR companies to bring that piece of the information together. But that's only a small portion of it. Things about you that relate to your health and your wellness are not just in medical records. They are related to your habits. They are related to your exercise and your Fitbit. They're being tracked on your Apple Watch and your other home medical devices. They are related to things that we do when we're not in the physician office and the doctor or the healthcare infrastructure. And so we are bringing all of that information together, in part spurred by the 20th Century's Cures Act that has had major legislation approved in the last 2 years that makes all of this information mandated and available for you. There's actually a patient access API. So if you all have your own API, you can connect to it. You don't have it, though, so we're building that for you so that you will be able to use our gateway to get your records. And you will, for the first time in the history of healthcare, be able to own your own data. And then you'll be able to decide what you want to do with that. Do you want to send it to another doctor for a second opinion? Or if you happen to be diagnosed with a condition or a rare disease, we'll be able to send you information about clinical trials that you can participate in, rather than waiting for a doctor to happen to be aware of that trial and maybe think whether they could get you into that trial. I could tell you a lot, probably go on forever about this. I want to keep my comments brief. It's a rapidly growing industry. Healthcare is one of the least digitized of the top 20 or so industries in the United States, according to a McKinsey report in 2016. It was published in HBR in 2017. So we're bringing that digital health revolution, starting with the cardiology. That's my particular area of expertise, and then across all disease verticals. Once again, thanks to the BizTimes and for everybody attending today. Much love to you.